Hi, I'm Brenda Tassova, and I'm a veterinary practice consultant, and today I'm here with Dr. Stacy Santee. Welcome, Stacy.
Hi.
How are you?
Good. Thanks for having me.
Where are you located?
I have a practice in Southwest Colorado in Durango. It's called Riverview Animal Hospital, or for Dr. Aha practice.
And you're the medical director there?
Yes, I have been since 2002.
Okay. So I'm sure that you work with your associates pretty closely and your entire team, really.
Mm-hmm.
Can you talk to me a little bit about preventative health care, why it's so important, and the message that you deliver to your clients when it comes to their patients' health and well-being?
Well, I think that preventative and wellness health care is proactive versus reactive medicine. And everybody I know in veterinary medicine is in it not for the killer money and the sweet hours, but they're in it because they love animals. And we're really trying to help them live their best life as long as possible. And I think there are 5 things you have to do to make that happen.
Okay.
This is what I tell my clients every day.
Okay.
If you want your pet to live as long as they can and have a happy life, you need to make sure that they have a trim body weight and they get moderate exercise. You need to make sure their mouth is clean and their body's not bombarded with bacteria all the time. You need to detect diseases early, so you've got to identify kidney insufficiency before it's too late. You need to identify hypothyroidism, liver disease, so we can make a difference. We need to prevent arthritis as long as we can, and then once it's there, we need to manage it and make sure you're not in pain. And the last thing, we've got to dodge cancer. And some of that's genetics, but also you can be very proactive by checking every lump, screening x-rays to find stuff early so we can get out of there and get you back to living a healthy life.
Awesome. And I mean, that's exactly the message that I want to hear as a pet owner. We're here at an AHA meeting. We're here doing continuing education. And I know that for me, being in practice management, I've been hearing a lot the last couple of years about how we really need to focus on preventative care and doing a better job there. What are your thoughts on that?
I mean, I think there's always opportunity for being better, and it's hard to know how good we're doing. I mean, we go in the room and we give our recommendations, but sometimes the client takes the recommendations, sometimes they don't, and after they leave, you kind of fall off the grid a little bit.
Okay. You said it's hard to know how well we're doing. Why is it hard to know how well we're doing?
Well, we're not really tracking it in any way. We do our best, you know, we pull data as we can, and we try to bring awareness to our team as best we can, but it's a challenge, especially when you're in the daily grind and you're working your tail off all day long. It's hard to know where to go for the information, and it's hard to know what to do once you have it.
Okay. All right. And I agree with you 100%. And actually see teams just kind of get distracted. And I think that's where we start to fall down a little bit. Do you think that you and your team have a sense of how well you're doing?
I think we have a feeling that we do a really good job. I don't know if that's true. I mean, I can gauge myself to how we're doing against other hospitals based on people I talk to and looking at our financial numbers. But as far as specifically knowing how well we're doing in dentistry, or how well are we doing in compliance on senior blood work, we run the numbers as we can, but who are we comparing it to? We're comparing it same data to ourselves a month ago or a year ago.
Okay. I agree. It's difficult. So I want to show you a new report by Vet Success.
Okay.
And this is called the Preventative Care Snapshot. It's not from your practice. We haven't put that together, but it's an anonymous report. But this is from one of the practices that we've been working with for a while. And I'm just going to share this with you. And I'd like to get your thoughts on what you're seeing. And actually, you're looking at the canine report. And down the side you can see are your preventative recommendations that you would be making for dogs. And then across the top, you can see that it's divided by age ranges because you have different protocols in place for different ages, right?
Mm-hmm.
So what jumps out at you?
We aren't doing very many fecals. The wellness exam is not too bad. I can see the blood work has opportunity for improvement.
Mm-hmm.
The heartworm definitely has opportunity for improvement. Yeah, it's very nice.
Are you seeing
Boy, look at the
tons of numbers? Is that a
dentals.
spreadsheet that you're looking at, or what does it look like to you?
Well, it's nice that it's laid out, and I can see the age groupings, and I can see things that I really care about in a concise way. The wellness exam, the heartworm test compliance, the blood work, the dental's completed. That's really nice. Wow.
What would you do with this if you took it back to your team?
I would tell my hospital manager she needs to help me. I think it would really give us a nice place to start a conversation and focus on some training as to why these things are important and why we recommend them and how doing these things can help animals live longer. Yeah.
So this report would give you a starting point, and then if you worked on those things and you got a report exactly like this 3 months from now, what's that going to do for your team?
Oh, it would really be able to let us know if we were doing a good job and our efforts were paying off, or sometimes even though it seems like it's a good idea on paper, you try to execute it, it doesn't pay off. You could go back to the drawing board and figure out where the barriers are. I could see it providing a lot of value.
Great.
Yeah, that's nice.
Well, we're excited about it, and we hope that it's going to be a great tool for not only practice owners and managers, but also for their entire team to elevate patient care.
I think everybody in the hospital would care about it.
Thank you.
Nice.